We are here this morning for the Franklin County Board of Commissioners General Session for July 14th, 2020. As a reminder, this is a public meeting and it is being recorded. We are kindly asking that everyone maintain the same level of decorum as if it were a public meeting in person. And finally, for those of you that are calling in, please ensure that you are muted by pressing *6 on your phone. We appreciate everybody being here today. Let's begin this morning's meeting with the Pledge of Allegiance led by Commissioner Boyce.
I pledge allegiance to the flag of the United States of America and to the republic which stands one nation under God, indivisible, with liberty and justice for all.
Indivisible, with liberty and justice. Thank you, Commissioner. All right, now we will need approval of the minutes of the November 26th, December 3rd, December 10th, 2019 general sessions, as well as the July 9th, 2020 briefing session and the July 6th, 8th, and 10th, 2020 administrative briefings.
So move.
Second.
Moved and seconded. Voting. Commissioner Boyce?
Yes.
Commissioner Brown?
Yes.
Commissioner Grady?
Yes.
The minutes have been approved.
All right. Now, first we'll move to the engineer, and we have a public hearing for the first resolution. So, Clerk Hindelang, if you could please read the public.
Thank you, Commissioner. Resolution regarding establishing, altering, and widening of Fisher Road between I-70 and McKinley Avenue, Franklin Township, Franklin County, Ohio. Engineer to file plans as necessary.
Good morning, Commissioners.
Mr. Robertson, how are you today?
Doing great. Good to see everyone.
Good.
For the record, my name is Cornell Robertson, County Engineer for every resident, every day in Franklin County. And Commissioners, if you like, I can describe this project before you open it up for public comment. This is a project in Franklin Township along Fisher Road from I-70 to McKinley Avenue. It's a cooperative project that includes the Commissioners, the Sheriff, the County Engineer, and City of Columbus. It's associated with the new jail and will widen the roadway, add turn lanes, traffic signal, and pedestrian facilities.
Great. All right. Now, if Clerk, if you may read. Well, first of all, I'd like to open the public hearing to anybody on the call who may be in the audience who'd like to speak on the public hearing. Is there anyone on the call or on the video conference who would like to speak to the public hearing? All right, well, hearing none or seeing none, we'll close the public hearing. And Clerk Hindelang, if you would please read the resolution into the record.
Thank you, Commissioner. Resolution number 461-20, establishing, altering, and widening of Fisher Road between I-70 and McKinley Avenue, Franklin Township, Franklin County, Ohio, viewed, engineer to file plans as necessary.
Just to add quickly, this resolution, if approved, will allow us to move forward with the project. It's the second resolution in a series of two to officially declare the project necessary.
Okay. All right.
Okay, that was on me. If there are no comments or questions, move for adoption of resolution 461-20.
Second.
Moved and seconded. Voting. Commissioner Boyce?
Yes.
Commissioner Brown?
Yes.
Commissioner Grady?
Yes.
Resolution number 461-20 has been adopted.
Thank you, Commissioners.
Thank you, Cornell. All right, to the Sheriff then.
Resolution number 462-20. Resolution authorizing an agreement with Vigilant Solutions, LLC for investigative data platform software in the amount of $34,060.
Good morning, Commissioners. Dave Masterson, representing Sheriff Dallas Baldwin. The resolution before you is a contract with Vigilant Solutions for license plate reader data availability from a law enforcement side and commercial side. This data has been found to be useful in helping solve some criminal activity. This will be the second year that we've had this software available should this be passed. And if any questions, I ask approval of this resolution.
If there are no comments or questions, move for adoption of 462-20.
Second.
Moved and seconded voting. Commissioner Boyce,
Yes.
Commissioner Brown,
Yes.
Commissioner O'Grady.
Yes.
Resolution number 462-20 has been adopted.
Thank you.
Thank you, Dave. To the Alcohol, Drug, and Mental Health Board.
Resolution number 463-20. Resolution declaring intent to proceed with the question of a tax levy for the support of mental health and substance abuse treatment and prevention services for children and adults to the electors of Franklin County at the November 3rd, 2020 general election.
Good morning, Commissioners. Zach Blair with the Office of Management and Budget and member of the Human Services Levy Review Committee. On behalf of the committee, we are recommending a proposed 5-year 2.85 mil levy that would be a renewal of an existing 2.2 mil levy with an increase of 0.65 mils that would be first collected in 2022. That would be placed, as the clerk mentioned, on the November 3rd general election ballot. After a thorough analysis at each levy request, and due to the economic uncertainty caused by the global COVID-19 pandemic, the committee's recommendation is for a levy that is a shorter term and more modest millage increase than the original ADMH request, which was submitted prior to the pandemic. This smaller increase would still allow for ADMH to continue their current operations, as well as make future investments to address critical community needs, such as support of the Franklin County Mental Health and Addiction Crisis Center, the Guardianship Services Board, and expanded efforts in the county correctional facility. A copy of the committee's full report was delivered to each of your offices on June 23rd, and the copy is published on the OMB website. This is the second and final step in the process of requesting the levy be placed on the November ballot. As a result of the pandemic, the Human Services Levy Review Committee had requested an earlier approval of the auditor's certification on the Commissioner's June 2nd agenda, 4 weeks earlier than the original timeline. This allowed ADMH time to update its analysis, revise its performance indicators, and gauge public support and awareness of the levy in light of the pandemic, asking this board to consider placing the levy on the November ballot. At this point, I'd like to turn it over to Erica Clark-Jones, CEO of ADMH, to discuss the results of this analysis.
Thank you, Zach. Good morning, Commissioners. At this time, I am joined today by two of my professional colleagues, our Board Chair, Peggy Anderson, and Sean Holt, the Executive Director of Mary Haven. Peggy?
Thank you, Erica. Good morning, and thank you, Commissioner O'Grady, Commissioner Boyce, and Commissioner Brown, for the opportunity to speak on behalf of the Alcohol, Drug, and Mental Health Board, or ADMH, of Franklin County. I know all of you in my day job as the Chief Operating Officer at Equitas Health, and I also serve as in a volunteer role of the Board Chair for ADMH. And I've been on the board since 2013 as appointed by the Commissioners. In my 7 years on the board, I've witnessed ADMH grow and adapt to meet the needs of our community and the changing needs brought forward by pandemic, the epidemic. We've done things like supporting the creation of mobile teams that enable clinicians to connect with people who are in crisis from a mental illness or substance use disorder. We've developed and funded prevention and intervention services in every public school district in our county. And we've expanded addiction recovery services to address the opioid epidemic by educating and distributing Narcan to families, funding more recovery housing, and using certified peer specialists to assist individuals in their recovery journey. And even now, when the community needs ADMH providers most, our network of Franklin County's behavioral health providers have been steadfast in supporting our community through one of the most difficult challenges of our lives, a worldwide pandemic, and an opioid use epidemic. With 92% of levy revenue distributed to community partners, and school-based program, Adam H. has done all of this without a voted millage increase in 29 years. This critical work would not be possible without the support of Franklin County voters who have trusted us with the resources for over 40 years. As Zach mentioned, our ask of the board to the Board of Commissioners today is to allow Franklin County voters to decide the future funding for Adam H. through a 5-year levy. Request that would include the renewal of our current 2.2 mils and a 0.65 mil increase, resulting in $22.75 per $100,000 home value per year, again, to begin collection in 2022. So again, thank you for the time to share our stories. I would now like to invite Sean Holt, CEO of Maryhaven, to share his perspective as a reliable Adam H. funded network provider.
Good morning, Commissioners. My name is Sean Holt, CEO of Maryhaven. Just to let you know, we have never closed. We've been on the front lines since this all started. Unfortunately, we've had probably about 30 of our staff actually test positive for COVID. 2, unfortunately, ended up in the ICU, and they have since recovered and are on their way to recovery. So just wanted to speak this morning about the importance of the Adam and the network and the stability that we have. Without the support of the Adam and Franklin County, we would not have been able to provide services to over 11,000 individuals last year. Just to share a success story, because I don't think we do that well enough all the time. I like to talk about a story about Stacy. He basically showed up with no insurance and a bag of clothes, basically, to Maryhaven. He was able to go through our treatment services and be successful. He owns his own painting company now. He's actually married, has started a family. And some of these type of things would not be able to be met or dealt with if it wasn't for the support of the Adam Board and Franklin County. So we appreciate Franklin County voters and their strong support of Adam, because as you guys know, we're dealing with 2 pandemics now. We're dealing not only with COVID, but the opioid crisis is still very well alive, and we thank you for your support. With that, I would like to invite Erica to speak a little bit about it.
Thank you so much. President O'Grady, Commissioners Boyce, Commissioner Brown, we appreciate the extended time on your agenda today. My name is Erica Clark-Jones, and I currently serve as the Chief Executive Officer for the Adam H. Board of Franklin County. I'd also like to publicly thank Peggy, our chair, Peggy Anderson, and Sean Holt, CEO of Maryhaven, for joining us today in their commitment to serve our community in these critical ways. I am also joined by my colleague, the acting Adam H. CFO, Mark Lambert, who has led our internal levy modeling process over the last 6 months, and he is available this morning to answer your fiscal related questions. I have a special acknowledgement for Zach Talarik and Chairman Jesse Hemphill, Mike Curtin, Rachel Buskey, and the members of the Human Services Levy Review Committee for their thoughtful recommendations that support our need for an increase in the level of behavioral health and crisis care across the county, especially in the face of this current pandemic. I joined the Adam H. Board in part because of its rich history in creating a safety net for persons who needed support managing mental illness and confronting addictions. Adam H. has a legacy of responsibility, reliability, and caring for our community's indigent persons in a human-centered and fiscally prudent way. As a reminder, Adam H. does not provide direct services, but partners with 33 nonprofit organizations such as Maryhaven, Centero, NetCare, Southeast, and Primary One Health that offer mental health and substance use disorder treatments and prevention efforts to Franklin County residents. As you heard, this support comprises 92% of our budget. The services and programs we fund support equitable access in Franklin County, regardless of race and regardless of ability to pay. The average age of an Adam H. consumer is 34 years old. 45% of our consumers are women, 56% of our consumers are self-identified as white, and 38% identify as Black or African American. Approximately 85% of all Adam H. consumers live below the federal poverty level. This pandemic has intensified the growing challenges in behavioral health. We see that all across the country. Across the United States last year, suicide rates increased by 39%. And according to Franklin County Coroner Ortiz, opiate-related deaths have increased by nearly 50% during the first quarter of 2020 alone. AdamH providers and their team of behavioral health professionals have proven to be essential during these trying times. When our county's first responders, most notably law enforcement, paramedics, hospital ER staff, and when any of them encounter persons in mental health or SUD crisis, they partner with an AdamH provider to ensure connections to ongoing support services to prevent future crises. This partnership helps to support a more comprehensive system of care that supports the well-being of our community. The Human Service Levy Committee recognizes the invaluable contributions of the AdamH board and the provider network, and they recommend that AdamH continue the work that we started 2 years ago to implement diverse payer models to increase cost effectiveness and focus on consumer-centered outcomes. The report also recommends pursuing a comprehensive analysis of a new Franklin County Mental Health and Addiction Crisis Center, for which we propose a multi-partner collaborative to share in both capital and operating costs, with the goal of increasing Medicaid and Medicare coverage for behavioral health costs at both the state and federal levels. A lot of work, we know. This new center would be a step in the right direction for altering the way crisis care is delivered in Franklin County and can produce cost savings system-wide by reducing the need for higher levels of inpatient care. The committee's recommendation to renew our current levy and to pursue an increase of 0.65 mils, which, as Peggy referenced, translates to an increase of $22.75 per year per $100,000 of home value to be collected beginning in 2022, is a prudent but responsible recommendation, one that AdamH is heeding during these times. Approximately 85% of the new millage, should it be granted by the voters, will be initially designated to maintain current service levels. In addition to the proposed crisis center, potential new investments may include the following areas: Guardianship Service Board, more medically assisted treatment programs, suicide prevention efforts, school-based prevention efforts, and housing for those unable to live alone due to persistent mental illness. As this unpredictable environment unfolds, AdamH is conducting a community needs assessment to better understand the service needs of our residents. The proposed 5-year levy cycle will allow us to ensure that behavioral health care supports remain strong for our consumers and our first responders partners alike. Appealing to the voters this November enables us to go before a large group of voters that best represents the electorate of Franklin County. For over 4 decades, AdamH has kept our promise to Franklin County voters. We remain committed to being good stewards of the money entrusted to us by the taxpayers, and will work diligently to most effectively meet the needs of the members of our community. Pending any questions, Commissioners, we ask for your approval of this resolution. Thank you.
My colleagues have any questions or comments?
Yeah, I got President O'Grady. May I ask a question?
Please.
Thank you. First of all, thank to Ms. Anderson, Mr. Holt, and certainly you, Ms. Clark-Jones, for the presentation today. I'm curious, this question is probably towards Mr. Holt. Do you plan to apply for any of the COVID-19 funds that are available, either through the city and counties resiliency fund partnership, or are there other ways that you have sought COVID-19 grant funds or other dollars?
Good morning, Commissioner Boyce. Yes, we do intend to apply for those. I think we were on the conference call that was held on Friday, so we appreciate that. We're in the position now where we're applying basically for everything that comes across the board, because, as you know, this pandemic has not stopped, and the clients continue to happen. They continue to overdose. This is a time of increased anxiety and panic. And I think the overdoses that you see that are going up, I think, attribute to the fact that people are using in isolation now. They're not able to get naloxone administered to them because they have anybody there with them. So yes, we intend to apply for all of that, sir.
Outstanding. And then I presume that you are in a network of other service or resource providers such as Mary Haven, I presume your network. Are you aware if they're going to be applying, some of your colleagues out there, if they're going to be applying as well and seeking funds? And do you know if they've had any made available to them already?
I think so. We're part of the Human Service Chamber as well, and I think some of my peers are willing to and hopefully apply for that as well. I think what's going on right now is I think it's so saturated. Everyone needs everything, and so by the time you apply for them and actually the awards come out, it's so watered down. I mean, it helps a little bit, but we got to continue to apply for them.
Excellent. Thank you so much for that. That's very helpful. And if I could direct my questions, Mr. President, back to Ms. Clark Jones. Mr. President, can I do that? Okay, thank you. Ms. Clark Jones, we talked about the linkage, as you all know, Franklin County is building probably its largest endeavor, I believe, in the history of Franklin County with regards to the new county jail facilities. And embedded in that is the ability and the idea that we can triage, as people come into our system, we can triage them to get the services that they need, whether it's mental health services, addiction services, substance abuse services, or whatever it is. And so I'm just wondering, as part of your plan to link to that system so that we can better have the type of triage that's needed, so that we're not just jailing people, but providing them with the right pathway to whatever services they need.
Commissioner Boyce, thank you for the question. And the answer is absolutely. Over the last 2 years, we have conducted a pilot program with our Southeast Mental Health Services and the Office of Justice Policy and Programs to administer services at the jail. Thinking ahead, we want to coordinate with the Sheriff's Office and Office of Justice Policy and Programs to make sure we are intervening, first of all, before, so that we could really, quite frankly, divert people from jail. If they've not yet committed a crime and their only crime is having a mental health crisis, we want to intervene early in the process. But then upon release, making sure that support is there to ensure community linkage. That is absolutely a priority for us. And it was a recommendation in the Human Service Levy Review Committee report that we partner more with law enforcement.
Great. Thank you.
I think never has this been needed more, the services that Adam provides to our local agencies. We are in such a crisis of both addiction and mental health issues, as well as the pandemic, which has exacerbated everything. So, yeah, I don't have a question, but I just think what you're doing is so important, and the minimal increase that you're asking right now is so needed. I know it's not easy for our residents, but it's so necessary. So thank you for taking the recommendation of the Human Service Levy Review Committee and taking that seriously. And I know they struggled to come up with something that made sense. And I appreciate you taking that very seriously and doing this 5-year plan. I think it's very prudent. I think it makes sense.
Thank you, Commissioners.
Thank you.
So, Erica, Mark, Peggy, Sean, for many months now, I know you guys have been pondering, what's the best road here. I know that the Levy Review Committee, I know our staff, I know that there's been a lot of folks we've hired. You've hired pollsters. We've looked into this and have studied this issue. We've had many conversations, and there's just been a lot of thought that's gone into this. And so I appreciate all of the work, the due diligence, the consideration that's gone into all of this. And so I agree with my colleagues when Commissioner Brown, I know, has made this comment several times, as have I, that this could not be more necessary at this particular time. And that I think, the voters will certainly understand that come fall, and that the messaging on this particular issue will be crucial because, for that particular reason. I also believe that that it is this is the right time, that this particular election cycle, not only because of the fact that it's so needed, but also because of the fact that the turnout will be so dramatically high this coming fall versus springtime next year, when the exact opposite will be the case. The turnout in the primary election of 2021 will be the antithesis of the turnout this coming fall. It will be the exact opposite of the minuscule next spring, and then the turnout next fall will be also pretty dramatically low as well. And so I think that this is the perfect window of time to be on the ballot for this particular issue. And so I'm glad that we were able to go through this exercise and make sure that that this was vetted and that the right decision was made in terms of what amount to put on the ballot, put before the voters at this crucial time for the clients and the folks that you serve with all the different constituencies that you serve. So I think this is important thing to do and the right time to do it. So thank you. Any other thoughts or questions from anybody?
Yeah, Commissioner Grady, I'd like to make a couple remarks. I was going to make them when we were voting, but I think I'll go ahead and make them now, if that's all right with you.
Sure.
Yep. Okay. Thank you. Let me just begin by thanking again the chair, Peggy Anderson, and who I just so value that volunteer work of being on a board in addition to all that you do professionally and personally. I think it's the highest kind of public service. And certainly to Erica Clark-Jones, I think you're working hard and transitioning very well into the role, and look forward to a really long relationship, doing the best that we can for substance abuse and mental health across Central Ohio. And then certainly Sean Holt over at Mary Haven. Appreciate you are a big part of the service delivery in Central Ohio, and there are no words to be said about what Mary Haven provides to Central Ohio. And then finally to my colleagues, Marilyn and John, I really do feel fortunate to be with two colleagues that are so experienced and adept to all of the needs of Central Ohio. You guys approach your job in the most professional way, and I learn so much from each of you every day, and I promise you, I mean that. In this process, in fact, I've really thought very long and hard about how I wanted to vote on this, and it's because of my colleagues, quite frankly, their passion and experience, that I'll be supporting the resolution today. But I want to be clear that it's because it goes on the ballot for the people to vote on it. And I would take what I think is a different perspective than my two colleagues, in all due respect, about the timing and what this means. But nonetheless, again, their passion, their leadership lead me to support putting this on the ballot to give the people, as Commissioner O'Grady said, the opportunity to weigh in. But if you don't mind, I do want to share just a couple of thoughts about why, if we were voting on this as an increase right now as a commissioner, I'd be voting no. And here's the reasons why. First, I think, and I think Ms. Erica Clark-Jones, you said it the best, we really don't know what the economic impact and environment around COVID-19 is. The bottom hasn't appeared to us yet. It's July, and the numbers are beginning to spike, which the secondary implication of that is an economic impact. And so I think not only do we not understand what the impact will be across the board economically, but it will also have an impact, as you indicated, on the needs of the Adam H. agency serving entities. And we just don't know what that is. And so my concern is the 5-year 0.60, I think it was, levy, it might not be enough. And to ask voters to take on that kind of burden and still not be able to meet the needs of a growing and problematic area of health and resource would be detrimental to our broader cause. And so I'm really concerned that we just don't have a feel for how 2020 is going to play out and what that means. Second, I'm concerned that we also haven't exhausted all resources to address your shortfall for 2021. As I understand it, we've got to get that under control. But with so many COVID-19 resources being made available by our federal government, and so many other resources that are untapped just to get through 2021, I think it would be more prudent to sort of wait and see, if you will, see what our real needs are after the pandemic, to see what the economic implications are, and to try to figure out a game plan with regards to current resources. And I just feel we haven't done that. Third, I'm concerned about the eviction and foreclosures rates that have increased. One economist dubbed it a housing apocalypse waiting for us. And I'm concerned that raising property tax in a time where people are vulnerable, our seniors are vulnerable, our homeowners are vulnerable. I read a statistic by CNBC just the other day that said 32% of people in the United States of America missed their July housing payment. The vast majority of them are homeowners. And I think we should be very conscientious about the secondary impact of, it's like the old saying, robbing Peter to pay Paul, and I don't want to exacerbate our mental health, substance abuse, and other needs by putting the pressure of increased property tax at the burden of the public. And then finally, I think I said this already, but just want to make sure. Finally, again, just the unknown of where the bottom is just leads me in a position to not feel that the timing of this increase is appropriate. We just don't know. I don't want to burden the public, and quite frankly, housing. We're already dealing with the affordable housing crisis, and I think we should be very thoughtful about how we approach these types of increases. And I appreciate the consideration going from 10 years to 5 years and reducing the millage. But there, I'm concerned that it's not enough. You've got to, if you're going to ask for a meaningful amount that will move the needle in the area we're trying to. Asking for an increase to maintain current levels isn't to me the way to go about it. And I know you're talking about some expansion, but it won't be to the level that is the most impactful, I would say. So I'll be voting yes, because I'm confident in my colleagues' perspective, and I really listen. They're the reasons why I'll be voting to put it on the ballot, because of their passion, their knowledge, and their perspective on this. But I at this point am not convinced it's the right thing to do. It's the right timing. But at the end of the day, we will give the voters an opportunity to weigh in on it, and I can be convinced otherwise to change my vote in the voting booth too. But that's where you come in as an agency, and with your efforts to help educate people like myself that this is more valuable than the things that I laid out in my comments. So thank you, Commissioner O'Grady, for indulging me, giving me the time to make remarks.
All right, you want to make a motion now?
Yes, sir. Let me just pull back up my. Oh, I didn't make it. I'm sorry. I didn't. Give me 1 second. I had to pull back up my iPad. It went to sleep. If there are no further comments or questions, move for adoption of 463-20.
Second.
Moved and seconded, voting Commissioner Boyce,
Yes.
Commissioner Brown,
Yes.
Commissioner O'Grady.
Yes.
Resolution number 463-20 has been adopted.
All right, let's, thank you, guys. Let's
Thank you,
move on
Commissioners.
to, let's move on now to, what is this? The,
Child support, Commissioner.
child support enforcement. Thank you.
Of course. Resolution number 464-20. Resolution authorizing a 4D contract between Franklin County Child Support Enforcement Agency and the Franklin County Clerk of Courts in the amount of $172,001.41.
Good morning, Commissioners. Susan Brown, representing the Franklin County CSEA. I ask your consideration this morning in approving this resolution to authorize the CSEA to enter into a one-year interagency agreement with the Franklin County Clerk of Courts beginning July 1st, 2020 through June 30th, 2021. The purpose of this contract is to reimburse the Clerk of Courts for expenses associated with the filing and maintenance of documents, including all motions, complaints, investigations, and other document entries required in the course of CSEA business and service of process. Each unit of service defined as a CSEA-initiated court docket entry will be reimbursed at a rate of $2.43 per entry, with a total of 202,970 entries anticipated to be devoted to this contract. The performance standard will remain to process all filings within 3 business days. The Franklin County CSEA and the Franklin County Clerk of Courts have had a long, successful history of collaboration in the establishment and enforcement of child support orders. Pending any questions, I request that this resolution be approved.
If there are no comments or questions, move for adoption of 464-20.
Second.
Moved and seconded, voting Commissioner Boyce,
Yes.
Commissioner Brown,
Yes.
Commissioner O'Grady.
Yes.
Resolution number 464-20 has been adopted.
Thank you, Commissioners.
Thank you,
very much,
Susan.
Susan. Economic Development and Planning.
All right, Commissioner. Before we get started,
We have a public hearing in Economic Development and Planning this morning.
we do, Commissioner. Would you like me to go ahead and read the public hearing into the record, sir?
Please.
Resolution to consider an annexation of 0.54 acres, more or less, from Jackson Township to the city of Grove City, case number ANX-10-20.
All right. Before proceeding, the witnesses must be sworn in. So would those of you speak on behalf of this, so that the oath can be administered, and then Clerk Hindley, please administer the oath as required to those who would like to speak.
Sure.
So most of you, I'm assuming, will be on the phone, but if you're on the call or if you're on the video conference, if you would like to speak on this, please make it clear, and the clerk will swear you in.
Craig Moncrief, attorney for the applicant.
Jenny Snap from EDP, and I believe Nick Soulis is here as well.
Mr. Soulis, will you be offering testimony?
No, just advice.
Thank you, sir. So to ensure that there's no confusion, and since we're on a Zoom call and it's hard to ensure that we are doing this appropriately, I will read the oath to both of you, and then at the conclusion, I will call on you to answer in the affirmative so that we can appropriately hear your response. So, all those who plan to present any testimony in this hearing regarding the proposed annexation of 0.54 acres from Jackson Township into the city of Grove City, annexation case number ANX-10-20, please raise your right hand. And Mr. Moncrief, I cannot see you, but my assumption is that you are doing so.
It's not letting me start video.
Hold on one second. I'm happy to fix that for you, sir.
There we go.
There we
Thank
go.
you.
So if you could please raise your right hand. Do you swear to tell the truth, the whole truth, and nothing but the truth under penalty of perjury, Ms. Snap?
I do.
And Mr. Moncrief?
I do.
Thank you. Commissioner?
All right. So we are now, so all those, you've done the sworn everybody in. I would like to then close the public, oh, I'm sorry. Wait a second.
Commissioner, at this time, we'll let those that have been sworn in offer their comments, if that's okay with you, sir.
Yeah, if you would, there. So if you want to go ahead, is Mr. Moncrief up first then?
It would be me, sorry, Commissioner.
I'm sorry. Go ahead, Jenny.
Sure, I'll go ahead and provide my testimony. This resolution is to consider a regular annexation of 0.54 acres, more or less, from Jackson Township to the city of Grove City. The area to be annexed includes 0.54 acres, more or less, at Demarest Road. That's parcel ID 160-1001593 and 160-0000929. Both of those parcels are east of Demarest, north of Grove City Road, west of Broadway, and south of Southwest Boulevard and Beulah Park. Additionally, please note 94% of the site's perimeter is contiguous with the city of Grove City. The petition was filed by agent and attorney Craig Moncrief from Plank Law Firm, who, as you see, is in attendance and will likely be providing testimony on behalf of the owner, Townsend Construction Company. The applicant has met all statutory requirements outlined in section 709.03 of the Ohio Revised Code, and at the conclusion of the testimony from the property owner or his agent, the board must determine the 5 criteria outlined and certified to be true by staff. And I can provide and list all 5 of those criteria for you after the attorney and the applicant has provided testimony. The applicant has provided proof of notification and timeline and has provided a resolution from the city of Grove City identifying the services that will be provided once the annexation has been approved. Resolution number CR-17-20 was passed by the city of Grove City on May 18th, 2020. Pending any questions, staff requests your approval of this resolution.
All right. Are there any comments or questions from any of my colleagues? Okay. Does Mr. Moncrief have anything he'd like to add?
Yeah, just to give you some background, this half acre is a part of the much larger 212 acre Beulah Park redevelopment. This is a project we've been working on for quite some time. It's going to add over 900 residential units to Grove City. It's going to add multiple commercial buildings, an assisted living facility, 32 acre park, really big development and great for Grove City. So in order to keep this kind of as one singular development to avoid any tax issues down the line, we're asking for a regular annexation of this very small area. It's 94% contiguous with Grove City, so there's no issues as far as leaving any Jackson Township property hanging. No street or highway will be divided as part of this. Grove City passed a resolution for services back in May 2020, and all owners of the property involved did sign this application. So that's all I have, and I open up to any questions or comments.
Mr. Moncrief, who's the developer here?
Townsend Construction Company. Pat Kelly.
Pat Kelly. Okay, that's what I thought. Okay. Met with Mr. Kelly yesterday on a different project that he's doing for the Catholic Baptist.
Okay.
Don't have any questions.
That'll either.
Okay. Well then, is there anyone else who would like to, that didn't get sworn in, that would like to speak on this subject? If not, I think we will close the public hearing at this time. And clerk, if you would read the resolution into the record.
Thank you, Commissioner. Resolution number 465-20, review of petition to annex 0.54 acres, more or less, from Jackson Township to the city of Grove City, case number ANX-10-20.
All right.
Do I make the motion now?
Dean, is there anything else we need to do here, or would we look
I just want to be, just real quick, Ms. Snap, did you want to list the 5 criteria?
Yeah, I think that would be advisable. So I just want to confirm, so before the commissioners make a motion and vote, that all 5 of the items are true in order to grant the annexation. And I'm going to read those out for you. The petition contains the signature of the majority of the owners of real estate in the territory, and then accurate legal description was included. 2, the Grove City has provided a statement of services to be provided once the territory proposed is annexed. 3, the territory is not unreasonably large. 4, on balance, the general good of the territory will be served and the benefits will outweigh the detriments to the surrounding area. And number 5, the no street or highway will be divided or segmented.
Okay. All right.
I believe that fulfills all of our requirements, Commissioner.
That's correct.
Okay. Well, then, now we can go for a motion for approval.
Okay. If there are no further comments or questions, move for adoption of 465-20.
Second.
Moved and seconded, voting. Commissioner Boyce,
Yes.
Commissioner Brown,
Yes.
Commissioner O'Grady.
Yes.
Resolution number 465-20 has been adopted. Thank you very much.
Mr.
Thank
Monte,
you.
thank you for your time. That was one of the more complicated annexations that we've had for quite a while.
Thank you.
And we
Thank
and
you.
over Zoom nonetheless, so that was even more, a little bit more of a difficulty. So thanks for your time.
Thank you.
Thank you, commissioners.
All right, thank you, Jenny. To the sanitary engineer department. Good morning. Ryan.
Resolution. Sorry, Commissioner. Resolution number 473-20. Resolution confirming authorizing the county administrator's action to repair sanitary sewer main and a purchase order for the needed repair in the amount of $244,500.
Good morning, commissioners. I guess I was muted at that time, so we'll start over again. Ryan Stowe on behalf of the sanitary engineer. The resolution before you is a continuation of the emergency sewer repair that was approved per resolution 431-20. And although the repair was successful, the pipe experienced further failure, collapsing during cleaning to remove gravel that was blocking the pipe. As there's no way to determine the extent of the collapse, the only option we have now is to excavate the pipe. And it is in the county's best interest to replace the whole span, meaning manhole to manhole, which is 190 feet, to ensure that there are no further issues. The biggest thing on this project is the main is 25 feet deep. So we want to make sure we do it right and do it once and don't have to revisit it again. Elite Excavating, who was the contractor that performed the repair and has performed previous repairs there, provided a quote to the county at the county's request for the additional work. The cost of the additional work is estimated to be $244,500. And given the circumstances, we find the cost to be fair and the contractor is available to start immediately. The county administrator has exercised his authority to enter into a contract on behalf of the county in the occurrence of emergency pursuant to Franklin County Board of Commissioners Resolution 1254-99, resolution authorizing the county administrator to perform administrative functions in a disaster or emergency situation. Pending any questions or comments, I request the passage of this resolution.
If there are no comments or questions, Move for adoption of 473-20.
Second.
Moved and seconded, voting Commissioner Boyce,
Yes.
Commissioner Brown,
Yes.
Commissioner O'Grady.
Yes.
Resolution number 473-20 has been adopted.
Thank you very much.
Thanks, Ryan. Emergency Management Agency.
Resolution number 466-20. Resolution authorizing the approval of the renewal agreement for the Everbridge mass notification system in the amount of $1,278,173.70.
Good morning, Commissioners. Jeff Young, representing Franklin County Emergency Management and Homeland Security. This resolution is for the renewal of our countywide mass notification system. Everbridge Software has provided this mass notification software since 2014 under GSA contract, and this renewal has been developed with the assistance of Franklin County Purchasing and reviewed by the Franklin County Prosecutor's Office. This software provides the capability to send alert and notifications to a variety of residents and employees within Franklin County through multiple contact paths, ranging from traditional phone lines, text messaging, and email. In the most recent 4 months, we have utilized this software to send 51 public alerts, ranging from severe weather, COVID-19, Buckeye alerts, City of Columbus curfew, and most recently, air quality alerts and the level 3 advisory with the state requirement to wear face masks. This most recent notification is one of several over the past several months we have sent via the wireless emergency alert system that pushes alerts to cell phones connecting to cellular towers within Franklin County. This renewal is for a 5-year period of time to provide this for system stability, locking in the annual cost of service and consistency of the approved license agreement. This program is funded through the proportionate share paid by all jurisdictions within Franklin County and is available to them for internal usage as well as in support of appropriate notifications to their residents. I'll gladly answer any questions and ask for your approval of this resolution.
If there are no comments or questions, move for adoption of 466-20.
I'll second.
Moved and seconded, voting Commissioner Boyce,
Yes.
Commissioner Brown,
Yes.
Commissioner O'Grady.
Yes.
Resolution number 466-20 has been adopted.
Thank you.
Thank you, Director. To Community Partnerships.
Resolution number 467-20. Resolution authorizing a supplemental appropriation for the distribution of CARES Act funding in support of the Columbus and Franklin County Resilience Initiative in the amount of $5 million.
Good morning, Commissioners. Dana McCrary, Administrator for Community Partnerships. This resolution will fund Franklin County's $5 million commitment to the Resilience Initiative. This is a joint RFP with the City of Columbus and Franklin County to provide resources for our nonprofit organizations who really are serving right now as the backbone and the safety net for our community, which has really been so devastated by the COVID-19 pandemic. If there are any questions, barring any questions, I would respectfully request the approval of this resolution.
There are no comments or questions. Move for adoption of one question. Where would agencies go to complete an application or resources?
Thank you for that question, Commissioner Boyce. On our website, on the Community Partnerships page, we have a link to the RFP. So it would take you directly to the United Way's EC Impact platform. We have a blank application on our webpage, and we also have a recording of the webinar walking applicants through the application process posted on our website as well.
Excellent. If there are no further comments or questions, move for adoption of 467-20.
Second.
Moved and seconded, voting Commissioner Boyce,
Yes.
Commissioner Brown,
Yes.
Commissioner O'Grady.
Yes.
Resolution number 467-20 has been adopted.
Thank you.
All right, to
Resolution number 468-20, resolution authorizing the addition of a Roth 457 option in the State of Ohio Deferred Compensation Plan and the CCAO Deferred Compensation Plan.
Good morning, Commissioners. Sue Hamilton from the Department of Human Resources. Today for your consideration is a resolution to allow our CCAO Deferred Comp Program and our State of Ohio Deferred Comp Program to provide a Roth 457 option for our employees. The Roth option expands retirement savings options to our employees that can provide tax advantages. County administrator will be able to execute the documents, and this will allow all three of our deferred compensation offerings to our employees to be able to offer the Roth option. Pending any questions you may have, I respectfully request your approval.
If there are no comments or questions, move for adoption of 468-20.
Second.
Moved and seconded, voting Commissioner Boyce,
Yes.
Commissioner Brown,
Yes.
Commissioner O'Grady.
yes.
Resolution number 468 has been adopted.
Thank you.
Thank you, Sue. To purchasing, please.
Resolution number 469-20, resolution approving purchases for various Franklin County agencies in the amount of $631,936.15.
Good morning, Commissioners. Megan Perry Balanier, Director of Purchasing. This resolution requests your approval of 48 purchase orders, which the county auditor has pre-certified available funding. This week, 10 out of 14 eligible POs totaling $92,554.15 are being presented for award to 2 small and emerging business enterprises, 6 women business enterprises, 1 minority business enterprise, and 1 local economically disadvantaged enterprise. This represents 71% of the eligible PO volume and 80% of the eligible PO dollar value. Pending any questions, I request your approval of this resolution.
If there are no comments or questions, I'm sorry, I got off the wrong page here. Shoot.
We're at 469-20, Commissioner.
Okay, thank you. Move for passage of 469-20.
Second.
Moved and seconded, voting Commissioner Boyce,
Yes.
Commissioner Brown,
Yes.
Commissioner O'Grady.
Yes.
Resolution number 469-20 has been adopted.
Thank you, Commissioners.
All right, so now we are to the Board of Commissioners.
Resolution number 470-20, resolution authorizing a COVID-19 response grant to African American Male Wellness Agency to address health disparities and advance mitigation of COVID-19 in disproportionately impacted communities in the amount of $175,000.
Good morning, Commissioners. Keena Smith, Deputy County Administrator. As part of the county's continuing efforts to stop the spread of the coronavirus, this COVID-19 response grant supports the African American Male Wellness Agency's Mask Up effort and the African American Male Wellness Walk. Mask Up will distribute 18,000 community care kits that include face coverings in vulnerable communities. And the African American Male Wellness Walk promotes healthy lifestyles to more than 100,000 African American men and their families. Before introducing our guests, I'd like to ask Director Joy Bibbins, Director of Franklin County Job and Family Services, if she has anything she'd like to add as she facilitated introduction of the Mask Up effort to county administration. Good morning, Joy.
Good morning. Good morning, Commissioners. Good morning, County Administration. Commissioners, as you know, when we did in 2018, we completed the Franklin County Poverty Blueprint Plan. Under one of those objectives was healthcare and access to quality healthcare. We see the African American Wellness Walk Administration, Mr. Gregory and Mr. Marlin as key community leaders during this time. We see this Mask Up campaign not just providing education, but resources to our most vulnerable communities during a time where we really need boots on the ground. And this organization has truly been boots on the ground. We feel that right now, with the mandates that have been put forth regarding the city of Columbus as well as Franklin County, masks are going to be needed more than ever, especially in our most vulnerable communities. So as your Franklin County Job and Family Services Director, I tremendously support this resolution and this organization. Yes, ma'am.
Have you identified, I know we have maps identifying the communities. Is this going to be using those maps that we have the largest outbreaks? Because we know there are areas like Reynoldsburg and Whitehall, in addition to areas in the city where there are large outbreaks of coronavirus. Will we be able to get the masks out to those areas? Because I've had people asking where exactly we're going to be with the mask.
So, Commissioner, what I will tell you is with Mr. Gregory and Marlon, we've worked hand in hand to identify some of those essential key areas that actually need masks, and they are committed, and they've been everywhere. They blanketed Franklin County, and they are being extremely intentional about addressing those high concentrated areas that we're seeing right now. We will continue to ensure in working with them that those areas receive the needed masks. Yes, ma'am.
Right.
Thank you, Joy. Commissioner, our speakers today are Mr. Marlon Platt and Mr. John Gregory from the African American Male Wellness Walk. Marlon.
Good morning, gentlemen. Good morning, gentlemen, and welcome.
Good morning.
Good morning. How's everybody doing today?
Good morning.
Great.
Good here. On behalf of the African American Male Wellness Agency and the African American Male Wellness Walk, we want to thank you all for your support from the county. To date, we originally started our Mask Up campaign back in May. We've worked in partnership with the Ohio State University Wexner Medical Center as well as Molina Healthcare. And to date, we've distributed over 60,000 masks to people in underserved communities. What we want to put an emphasis on is not only providing masks, but providing resources to these communities to help them deal with the COVID-19 virus, but we want to provide community awareness and education so that we can put a slowing stop to this pandemic. As you may or may not know, the African American community was one of those hardest hit by the coronavirus pandemic due to health disparities and inequities in our community. And what we want to go about doing is educating those in these hard to reach underserved communities about how, one, they can get healthier through nutrition and through preventative care, and two, by providing masks and other resources such as sanitizers to these communities, and also additional education on how they can stay safe during these times. I know there was a mention about how we go about engaging. People think of Franklin County and they don't fail to realize that it's also Reynoldsburg, it's also Hilliard, it's also these neighborhoods, and people just think about Columbus. But we have a set forth intentional plan of going to these communities, getting boots on the ground, and actually going into these neighborhoods to distribute hand-to-hand these care packages that we will be putting together. So I wish I could show you guys our conference room. We've been distributing in partnership also with CMHA. We provided over 1,400 care packages to households in their communities over the past week. So we feel like we have a good plan and a good blueprint. And we want to thank the county and the commissioner's office and also Ms. Smith and Director Bivens for their support and advocating on our behalf.
That's great. I'm thrilled. I know how hard you're working in the community on other issues. So this is terrific. I'm really pleased that we're doing this.
Thank you.
Mr. Gregory, would you like to add anything? You're muted, John, if you're speaking.
Hello.
Yeah.
Can you hear me?
We can hear you.
Oh,
okay.
yeah.
All right. I'd just like to say thank you to the commissioners. I'd like to add to what Commissioner Boyd said the other day. The commissioners, you are the human service arm for the county. Director Bivens does a great job of getting the services out to the community, and so we are so appreciative that we have an opportunity to go to the hard hardest served neighborhoods and be able to provide them a service. Let me give you an example. We have not been closed at all during the pandemic, during this COVID-19. And we do a project with you through our Best Care project. And last week we saw over 52 people who came in to talk about their benefits. Not one of those people had a mask, not one. We had to give each person a mask kit. And what we was able to do is sit down and explain to them the purpose of the mask and why they should have the mask. And so our efforts are going to be really more about education. What we know is the communities that we're going to, they don't have a clear understanding of this whole epidemic. And what we intend to do is do a lot of pop-up tents so that people can come and get the mask, but at the same time, we want to provide them an education. And when Commissioner Boyce said last week that the Human Services Department is the one that really does for the mission of human services for the county, that is the truth. So everything that we have done with you all, it has been about changing the lives of individuals. In addition, on August 8th, we will be having the African American Male Wellness Walk. This year we have made it the walk that is a freedom walk, that we are walking to fight racism, as you have declared it, a health disparity and health disparities. So we are asking individuals to walk from their home, to leave their community, walk in their community, map out 3.1 miles, walk in their neighborhood, walk in the park in their neighborhood, and walk in groups of less than 10. And at the same time, maybe carry a picture of someone who they know who has a health disparity, or who have passed from a health disparity. We believe that this is an awareness campaign. We have lots of awareness materials that we'll be getting out over the next several weeks. We are glad that the county is the leading sponsor for this event. And you're going to be seeing things on the news, on the social media, that really lets people know that the Franklin County Commissioners are in for fighting health disparities and fighting health disparities as it relates to racism. So we're excited. We are going to provide free COVID screening, particularly trying to get men to get COVID screened. And we will have a whole week where we'll allow men to come get screened. And one of the things that's really kind of interesting, we're in partnership with the Ohio State University, where we're doing an African American males research project. It's called Black Impact. And this past week, we had to take 3 men from the event, and we're meeting up individually across the city. We had to take 3 men to the hospital who came out to participate in the research project. So we know that what we're doing is critical, but we thank the county commissioners, we thank Director Vivens, we thank Keena, that the efforts that we're trying to do is going to be rewarded through the saving of lives. And so we appreciate that.
John, I know when you and your team get to working in the community, it really matters. And so I thank you and your team with the all of the work that you're doing. This is Commissioner Brown, and I think your work is amazing, and what you're doing makes a difference. So thank you.
Thank you.
I only add, Commissioner O'Grady, if I may, I only add that to Commissioner Brown's point, the work you do is tremendous, but I would zero in on the wellness element that you promote year round. You know, African American men are on the bottom rung in nearly every health disparate category that you can think of: diabetes, hypertension, obesity, and other chronic illnesses. And the work to promote regular screenings, to promote wellness and eating habits and exercise and mental health are all critical resources that are making a difference in the broader picture. And so while the mask up is sort of the 2020 COVID-19 kind of highlight, the work you're doing year round to promote wellness is, to me, as impactful as the Mask Up program too. So thank you for what you do. Thank you for what you represent. And it's good to be have a partner like your team.
And Commissioner Boyce, if I may, I'm sorry, Kevon Lawson here, Executive Director of the African American Male Wellness Agency. When we are talking about health disparities, one of the things that we came together as a group and decided upon was that when we say health disparities, people don't really know what that means, right? And so to your point, Commissioner Boyce, on the back of our literature, it actually has statistics about what health disparities are and how it affects Black men in particularly. So we literally out to help continue to educate the community. So I just wanted to commend you on that point as well, that we're actually doing that work in terms of educating as well as serving.
Absolutely.
So not only, I mean, the work you guys do in the community is tremendous. It's uplifting. As a, certainly I'm not African American, but as a guy who has gotten to a point in his life where, it'll be just a few years from now, I will have spent more of my life battling health issues than.
Commissioner, it looks like we've lost your signal, sir. Commissioner O'Grady? Commissioner Brown, did you want to say anything else while we get Commissioner O'Grady back?
Commissioner Brown, I have a question when you get a moment as well, if I could.
Sure. Go ahead.
It's directed to Mr. Gregory. Mr. Gregory, for the last 2 years, Job and Family Services have won a trophy as we have walked in the African American Wellness Walk. And I just kind of want you to let our other levy agencies know. I don't know how I'm going to win. Just put them on notice that I have a question, that I don't know how I'm going to win my trophy this year.
I think you will figure it out, Joy, because you are very competitive, and you'll figure that out. I think that the more people, what we're going to do is Channel 4 is going to streamline the event, and we're going to have people call in and send videos in. So one of the things we'll be able to do is monitor the number of videos that people send in from different agencies and different communities. And I do want to say something before I leave to the commissioners. You fund another program we do. And as we have talked about the uptick of violence among young people in the city of Columbus, I do want to tell you that this past Saturday, we celebrated, you fund the AMP program for us, where you funded us to work with 100 African-American youth. That's who we're working with. And I want to tell you that this past week, we were able to give 73 of those kids who had dropped out of high school a high school diploma. And 50% of them were African-American young men, and they're all going to college.
Oh, awesome.
That's wonderful.
That is. Thank you for that, John. And I think that you just might want to give Director Bivens a trophy just because, I mean.
No, we're going to give the trophy to you.
Bivens. What'd you say, John?
I said, we're going to give the trophy to you. I do have a question to ask before I get off the phone, because we're going to start immediately. Do we have to send the marketing material to somebody to get approved?
Yes. You can send it to me and Bart, and we will take a look at it. And we'll
Okay.
turn it around as soon as possible.
Okay, thanks.
Dean, are we able to get Commissioner O'Grady back?
Commissioner O'Grady signing in. Commissioner Brown and Boyce, we maintain a quorum, so if one of you would like to move forward, we are able to do so.
Is that your pleasure, commissioners, or would you prefer to wait?
I'm okay with moving forward.
We should do that.
If there are no further questions, I respectfully request approval of this resolution.
All right. If there are no further comments or questions, move for adoption of 470-20.
Second.
Moved and seconded. Voting, Commissioner Boyce?
Yes.
Commissioner Brown?
Yes.
And Commissioner Grady, I have seen you. You have rejoined us, sir. We're voting on resolution number 470-20.
Yes.
Thank you. Welcome back, Commissioner.
Welcome back. Welcome back, Mr. President.
That was interesting. Technical difficulties.
The wonders of technology.
I'm back.
Hey, Commissioner O'Grady.
Yes, sir.
I was actually interested in what you're about to say. You were saying that you had spent, soon you'll have spent more years battling health challenges. I'm interested in what you were going to say, if you don't mind.
Yeah, I would like to. And if it'll be just a few years down the road, I will have spent more of my life battling heart issues and health issues than I was healthy as a young man, and I was extraordinarily healthy as a youngster. I was a wrestler and a football player, but and so the work that Mr. Gregory's organization does to convince folks that they need to go to the doctor, that they need to have health screenings, that they need to pay attention to their health. I wouldn't be here today if I wasn't meticulous about making my appointments and taking my medicine. And I can't skip my doctor's appointments. I can't skip my meds and miss my courses of meds. I can't do that stuff. If I do, I end up in the hospital. You guys, most of the people that know me from Franklin County government know that when I miss my medications or when I miss my doctor's appointments, that's when something bad happens to me. And so not going to the doctor, not ignoring symptoms and saying, and trying to, tough it out and trying to, be macho about something and say, it happens to somebody else. That's what got me sick in the first place. Ignoring signs and thinking that I was Superman and thinking that, because I had dealt with pain and I had dealt with health issues for 35 years of my life is what got me into the trouble that I was in. I thought that I was superhuman. I thought that I was strong. And then I went into the hospital and I had open heart surgery and I was on the table for 16 hours. And when I woke up, the doctor told me that because I was so strong and because I was so, I had been, because I was such, a bull is the reason that I lived, but that if I continued to try to live like that I wasn't going to make it, that I was never going to make it to 70 or 75 years old. And I wanted to. I had 2 young kids and I wanted to live the rest of my life. And so I have been very meticulous, very religious, very, very much, it's been a struggle. It's been more than 20 years now that I've been living with this. And so in another 10 years, I will have spent, half my life battling heart disease, or approaching that. And so, I've got, you've got to be aware. You've got to go to the doctor. You've got to listen to your body. You've got to, when people urge you to seek medical advice, you need to do it. When your doctor says take your medications, you need to take them. When it's time to get out and get some exercise, you need to do it. And especially during this, we talked about it earlier in the session. When you're at home during a pandemic and you don't spend time with other folks, you need to listen, to people when they say, go get some exercise, go get out of the house, change your mental focus. Go visit somebody, wear a mask while you're doing it. But, mental health is a big issue right now. And so what John Gregory and his organization are doing and wellness right now in particular is unbelievably important. And I applaud you, sir, for the work that you've done for years, but in particular, the work that you are doing today. You and your organization, John, Moran, the stuff that you guys are doing is so needed always, but especially is so needed today. Thank you.
Thank you.
Thank you, everyone. Commissioner, with your permission, I'll move on to the next resolution.
Yes, please. Sorry.
Thank you. Resolution number 471-20, Resolution authorizing the county administrator to enter into an agreement with the Cardinal Group 2.
Good morning, Commissioners. Chris Long, Deputy Administrator. There are a handful of technical items that we're finalizing, and with your permission, we would ask that this resolution be tabled for 1 week, and then I'll come back in front of you with the finalized resolution and accompanying documentation.
Are you sure you don't want to table it indefinitely, or just?
Positive.
Okay,
Positive.
all right.
Positive.
All right, if there are no comments or
Famous
questions.
last words.
That's very famous last words, I know. On the Zoom
Right.
call to be recorded forever.
You know, Commissioner Brown doesn't like to table things indefinitely, so when she's giving you an option, you should think about it.
If there are no comments or questions, move to table for 1 week.
Second.
Moved and seconded voting. Commissioner Boyce,
Yes.
Commissioner Brown,
Yes.
Commissioner O'Grady.
Yes.
Resolution number 471-20 has been tabled until July 21st. Thank you.
Thank you, Commissioners.
All right.
Resolution number 472-20, resolution authorizing the county administrator to apply for a zoning variance and a special permit for the purpose of providing halfway house services for the property located at 1717 Allen Creek Drive.
And Commissioners, Marty Sweaterlich, who is counsel for Elvis, is here to present this resolution. Marty?
Good morning, Commissioners. Thank you for this opportunity. I'm not completely sure why my video isn't showing, but let me see if I can make that work. What we have today is a resolution to authorize the Elvis House to apply for a zoning of an amendment to their special permit for the facility that exists on the Alum Creek Road property so that they can expand the facility. As I said last week, the original request that you gave, to which you responded in 2018, was to increase from 104 beds to add another 200 beds to make it a 304 bed facility. We are asking for an additional 50 beds on top of that, which would make it a 354 bed halfway house facility. There are 3 variances being requested. One is to the size requirements under the city ordinance for halfway houses. The second is because it is within 1,000 feet of both Maryhaven and the county corrections facility. And again, they are similar facilities, and the city ordinance requires a variance there. I have provided this late last night, and I apologize. I've provided what I hope is the final draft of the application with a revised site plan in it. It looks pretty similar to the site plan that you saw last week. I did not get it until after close of business yesterday from Moody Nolan. There is an additional there are additional parking spaces in this revised site, which is certainly one of the key issues here because we are committed to provide additional parking for both Maryhaven and for CBCF. They accomplished this by realizing that they didn't have to honor that little circular driveway that, in my view, went to nowhere, kind of on the front of the property. So they were able to absorb that and use it for parking and adjust the entrance to adjust the front entrance. So if you take a look at it, it is simply an addition to the existing facility, moving toward Alum Creek Road with the parking toward Alum Creek Road. I'm happy to entertain, I'm happy to entertain any questions you might have about the application. I'm having my own technical difficulties here keeping stuff up on my screen.
And Commissioners, the article that Marty referenced was forwarded to you and your staff this morning.
If there are no comments or questions, move for adoption of 472-20.
Second.
Moved and seconded voting. Commissioner Boyce,
Yes.
Commissioner Brown,
Yes.
Commissioner O'Grady.
Yes.
Resolution number 472-20 has been adopted.
Thank you very much. Can I ask one other question? I'm going to send just the signature page over separately to be signed. And I believe the resolution requires the county administrator to sign that. So Chris, I guess I'll just send it to you and you can sort that for me.
That would be fine, Marty. Thank you.
Okay. We're filing it. Hopefully I'm going to file it on Friday, so I'll get it over to you very quickly.
Thank you.
Thank you, Marty.
Sure.
Clerk Kinderling, do we have any journalizations this morning?
One, Commissioner, from the Economic Development and Planning Department. Case number ANX-12-20, an expedited type 2 annexation petition, ANX-12-20 was filed with the Franklin County Economic Development and Planning Department on July 7th, 2020. The petition is requesting to annex 2.8 acres, more or less, from Mifflin Township to the city of Columbus. The petition will be considered by the Board of Commissioners on August 11th, 2020. Site 1690 Stelzer Road, PID number 190-000340, 1700 to 1760 Stelzer Road, PID number 190-001883, and 2844 Johnstown Road, PID number 190-001884.
All right, before we open up the floor to questioning from any media that we may have, I wanted to take a second to remember Bill Flaherty. Bill, and I should have done this at the beginning of the meeting, but I had a little confusion in that my iPad was about to die, which it did do in the middle of the meeting. But Bill Flaherty was a member of the staff of the Franklin County Board of Commissioners from 2005 until, I don't know, probably 2015 or so, 14, 15, somewhere in that range, for probably in a good 8-9 years, somewhere in that range. Anyway, Bill was a deputy county administrator and did a fantastic job working on behalf of the commissioners. Bill was a deputy county administrator back at the time when it was just he and Don Brown, which was a lot of work. Don was the county administrator and Bill was the deputy county administrator, and it was a huge amount of work for two folks. And when I came to the board, the first thing I did was talk to Marilyn, and I said, Marilyn, we need to figure out something because Don and Bill are handling a huge amount of work between the two of them. And so we began to look at the expansion of the deputy county administrator role, and now we have 3 deputy county administrators. And when we travel around the state and around the country and meet with our colleagues, we realize that that's how everyone does it. And Don and Bill were just simply overworked. And Bill worked for the state of Ohio before that in the administration of Governor Dick Celeste, and he just was truly a fantastic public servant. He was one great guy. He gave us great advice, and he just knew a lot about public service. He knew a lot about government work, about public policy, and he just was a great guy, and we miss him. We've missed him since he left county government. We miss him now that he passed away the other night after battling leukemia for a number of years. He was a valiant soldier in that. He battled leukemia for a number of years. He was in and out of remission on a few occasions, and he succumbed to leukemia Saturday evening, late Saturday night, very peacefully at home. And so his wife Cindy, and so we will miss Bill. And so would like to ask everybody if they would take a moment of silence to remember Bill Flaherty. All right, thank you, everyone. I appreciate it. Now, if there's anybody, I know usually we have some member of the media that's on the call that might have some interest in asking. There is Mark. How are you, Mr. Kovac?
I'm okay. Technically, I'm off today, so I'll refrain from asking any difficult questions till Thursday.
Okay. All right. Well, look at you. You're off work, but
Good to see you,
just
Mark.
an interested observer, just an interested.
Can't get enough public meetings, you know?
Well, we all do so many of these conference calls and Zoom meetings. I've gotten to the point where I do very little Zoom when I'm not working, because it's just gotten to be too much. All right. Anybody else from the media need to ask us anything?
No, I would just say I agree with you about Bill Flaherty. He was the ultimate public servant. He was what we would say in Yiddish, a mensch.
Yeah, it's true. Bill was the guy who you thought you had it right. You thought you knew what you were doing, and Bill would walk into your office and he'd say, "Have you thought about this?" Or he'd bring you a book, or he'd bring you an article, and he'd say, "Hey, give this a look," And he was just he was just that kind of guy, real dedicated public servant, and just a good guy. And we'll miss him. Liked him a lot. Good fellow. So anyway, thanks everybody. We will see you next week, and some of you we will talk to tomorrow morning. And take care and stay safe.
Thank you, everyone.